Hi everyone, I'm Neil Emar Mejia Diaz, 26 from Magalang, Pampanga. Ang first kong nose filler here at CSA is way back 2015. Ang sabi ni Doc is just for 3 years, but magpa 5 years na siya ngayon. Visible pa siya, but ngayon, ile-level up ko naman siya. Mas papatangusin ko siya at dadagdagan namin ni Doc yung nose fillers ko for today. At kung interesado ka sa nose enhancement, just click the subscribe button and notification bell to keep you posted and updated.
Good day everyone, welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we have a repeat nose treatment and we have with us, he's been our 5-year client. Let's all welcome Neil.
Hello po! Hi again!
Yan. Welcome Neil sa ating CSA episode. Okay, so Neil had done a nose injection 5 years ago. Okay, and he had shared with us yung effect and he was saying na somehow meron pa siyang naging remnant inside. And so, after 5 years, Neil is here to have a repeat injection. Right, Neil?
Yes, Doc.
Okay. So, sa CSA, whenever we do a treatment, importante sa amin yung analysis also. We again check for the nose anatomy. We have to analyze kasi 5 years na actually the nose injection that was inserted, that was done, nag-hydrolyze na po yung product. Okay? But we were mentioning before na after hydrolysis, somehow there's a development of some tissue fibers inside. Okay? So we did in the past injection into the nose bridge and also tip and into the columella. So the procedure 5 years ago, pero the nose of Neil maganda pa rin. Right? Okay.
Yes, Doc.
Actually, okay naman eh. Nasa ideal shape of nose naman eh. But then of course, if we still wanted to enhance, pwede pang i-enhance. Now for Neil, the best nose profile will be a higher radix here. Okay, so nose anatomy, okay, yung deepest portion ng ating nose is called the radix. And then when you go inferior to that, merong rin yun, yung parang bump, that's a bony part, okay? And then the bony part of the nose is up to here. The distal third has a so-called cartilaginous structure na. So there's this bone and cartilage connection. Sometimes yung iba, they see like a supratip break. Parang merong indentation dun sa distal third ng nose. Yun yung connection po ng nasal bone and nasal cartilage. Kaya yung iba, meron silang parang dent doon sa part ng lower third of the nose. Di ba nanonotice mo? Some of the others have that kind of concern.
Okay.
Meron silang malalim dito or indentation. Then when we come to the tip region ng nose, so we have the supratip, the tip defining point, and then the infratip. Now when I do injection para sa ating nasal bridge augmentation, I already make an entry point na dun sa infratip region. And when I do a nasal tip projection naman, I do my entry point doon sa pinaka tip defining point. So, kay Neil, we can still elevate. Ang goal natin is increase this radix projection here and also project yung kanyang nasal tip so we can still project it forward anteriorly. So, pwede pa natin siyang i-elevate tong part na to. And then, following yung ating mga measurements, yung mga angles, so sabi natin, we have the nasofrontal angle around 110 to 130 degrees. And then going here, the nasolabial angle. For men, we prefer the 90 degrees to about 95 or even 100 degrees. So kay Neil, we can still have this better nasolabial angle. Okay? Now, let's have Neil smile nga. Yan. So there's also a concern for some, yung tinatawag na alar flaring. Yan. Kasi there's a muscle there that widens the nose. So we also use an injection for that one to somehow narrow it. Right? Kasi some people will wanna have narrower nose pa eh. Although for men, there's a certain like a width ng alars. It's accepted for men na mas wider than the women. Okay? We also follow the rule of fifths. So within the rule of fifths, yung center fifth na yon, within the medial cantay ng mata, dapat pasok yung ating alars doon. So these are the rules of proportions. Yan. So dapat tamang-tamang measurement and it should be balanced and it should be symmetrical. So ngayon, ano ba yung magiging treatment natin kay Neil? Excited ka ba, Neil, to know?
So much.
Yeah. Before we were talking about the nose filler, we did nose filling for Neil. Right now, it's also filling in the nose bridge, the tip columella, but we'll use a product na I should say, kung baga, tumatagal din, and at the same time, it further gives a better shape, much defined shape for the bridge, for the tip. So, let's check ano ba yung ating next na procedure. And we're back mga ka-CSA. So, we'll now start with our non-surgical nose enhancement for Neil. So, step 1 is to anesthetize the area of injection. So, we have our infratip here for our entry point. Okay. Inhale, exhale, Neil. Okay. So, that's the lidocaine. And after anesthetizing the area, now we'll make our entry point. Entry point, infratip region. Okay. Then I will be using my PDO threads. This one is Wyco PDO thread or polydioxanone. So inserting that entire length of this Wyco PDO towards the radix region. Actually, I'm already sensing some resistance because this is the repeat injection of Neil. So we expect to have some fibrous tissues that had developed in the past. Okay, and then our third one. So this is inserting this Wyco PDO polydioxanone into the nasal bridge. So this is my fourth PDO thread. Okay. So ideally, we have to stay in the midline region and it's in a deeper anatomical plane. Okay, and then this one. So these types of threads have variable or varying lengths. So depending on the length of the nose of our patient, we also follow that length and we use the type of thread with the kind of length that will fit in the nasal bridge. So sometimes we have patients with shorter nose and the length of the thread exceeds, so that's fine. You just need to cut the excess thread in the opening. So again, we have variable lengths of the threads. Even the cannula, ideally the cannula is 60 millimeter, and then with our length of the thread, it could be 70 millimeter, 80 millimeter, or 90 millimeter. So let us proceed to the nasal tip projection. I'll make another entry point into the tip defining point. Okay, And then I'll use my Wyco PDO 40mm here to project the nasal tip. Okay, I'll pinch the columella here to be able to grasp the cannula between the two fingers. So, some resistance here. Okay, inhale, exhale, nail. Okay, there you go. Ideally, I have to reach that anterior nasal spine. And another one. So, this is a Wyco polydioxanone for tip projection. I'm using my 40mm. Inhale, exhale. Okay. So this is our last PDO thread for the tip projection, and we're done. So we did the nasal bridge projection using our Wyco PDO threads. We use about 12 PDO threads for this one, and then for our nasal tip projection, we use about 4 PDO threads. Okay, so the next part, of course, kailangan nating linisin yung area. So we clear the skin from any tinge of bleeding, and then the next will be to show the result to Neil. So let's now show to Neil the outcome of his nose enhancement. Okay, Neil, here's our mirror. Okay, you can hold on to this, right? Yeah. So, noticeable result, instant result, natural result. Yan.
Sobra naman, Doc. Ang ganda.
Right? So, we have achieved our goal of elevating the nasal bridge and projecting the nasal tip. Nung na-project natin yung nasal tip, nasama yung sides, yung alars. Nag-narrow din yung alars ni Neil. Right?
Yes.
Yan. And later on, I'll add yung botox na rin para sa alars niya to relax yung muscles na nagwa-widen ng kanyang alars or to reduce the alar flaring. Okay. So, anong masishare mo sa ating televiewers?
If you have insecurities na medyo mababa yung bridge ninyo, si Doc Contessa ang sagot talaga for non-surgical nose.
Right. And speaking of that, iba-iba rin kasi yung height ng bridge natin. Some individuals already have that elevation. For some, very minimal elevation lang ng nose bridge. That's why we have a lot of episodes on non-surgical nose enhancement to also inform you that we don't have the same nose anatomy. Okay? Even yung sa Asian, Caucasians, hindi rin pareho. Yung mga Caucasians, kitang-kita natin yung kanilang nasal bridge talagang projected. And sometimes medyo excessive naman yung pagka-projected ng kanilang bridge, right? Or excessive yung kanilang tip projection. Yung iba, they have this hump on this bridge part. Tapos yung iba, sobrang projected or very high nose naman. And then the others, inadequate yung height, inadequate yung length. So, we have varying anatomy ng ating nose. That's why yung pong mga nag-inquire din po, if you're asking us how much, we really need to see or evaluate your nose anatomy. So, yun lang naman po yung request namin. That if you send us an email or inquire about how much yung cost, we have to check muna po kung paano po ba yung appearance ng ating nose. So, we can share or we can actually give you the exact amount or also give you an idea ano ba yung kailangan nating product materials, ilan po yung or what is the amount or how many of these threads to insert kasi the others are asking ilang threads po ba. So, it will depend po on your type of nose. Ayan, nasagot yung isang tanong ng mga yung mga concerns po, nasagot din. Right? Thank you, Neil. Thank you for your time.
Thank you, Doc.
I know,
Thank you.
Neil is also busy. Okay?
Opo.
And I'm so happy with the result. Okay? Yan, tignan nyo naman po. Instant ang result. Actually, natural looking pa rin. It's still Neil. Hindi naman
Ako lang
nagbago.
to.
Right? And I like also the slope appearance. Actually, yan yung trend din also. Hindi naman yung sobrang straight. Somehow, there's still that angle dito sa ating nasal bridge. Okay. So, walang concern? Tanong, Neil? After the treatment?
Second time ko na po ito.
Yeah, second time. So, that's why alam na niya ano yung post-care, ano yung mga ipiprevent or i-avoid yan. So, wala nang, and then we'll just give some mga prophylaxis antibiotics or pain reliever lang, rest muna at home, no heavy or strenuous exercises, huwag magbubuhat ng mabibigat. Yun yung mga typical na advices lang, home advices. O yan, maraming salamat po sa inyong lahat na nanood ng aming episode ngayon. If you have any questions, you may email us at csaskinclinic@yahoo.com or you may also message us at our Instagram, CSA Derm Centre, or our FB page, CSA Derm Centre. Ang iba naming mga videos ay nasa aming YouTube channel. Please do not forget to click the subscribe button as well as the notification bell. And maaari rin po ninyong i-share sa inyong mga family and friends who could be interested with aesthetic, non-surgical, non-invasive, and minimally invasive procedures tulad po nito. Okay? So God bless you all. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.